The idea is to make a review of all the cases that we have published and to identify all this molecular targeted therapy that was already provided as part of case report or as part of clinical trials in order to help clinicians to make a decision. So it's not an approach one fits all. We need to identify the patient with a specific modification and to propose to them a targeted therapy. So clear cell, I agree with you, it's a very good example, and we need to share this experience because, as you know, in different countries we have different access of drugs. So the idea is as soon as we identify in a rare disease something and we have a very interesting response rate, we need to report this case report so the community is aware and they can use this argument to ask this treatment for their own patients. So it's a good example, and I think in the future we're going to have some clinical trials also in this field evaluating targeted therapy for specific molecular subtype. We need to say that in sarcoma, the problem that we have is that we treat the patients accordingly other disease. So for the time being, expect Tamezostat, that we saw some data also for the Ewing sarcoma in this meeting that we had. We do not have other drug that we use only for sarcoma. Maybe an exception is the GIST and Avapritinib with this rare mutation. So we can do the start, but we need also to know how the colleagues from other diseases treat their patients, and we can apply this treatment to our patients so they can have some benefit.